Rohith Saravanan. I'm the Chief Medical Officer for Odessa Regional Medical Center and Scenic Mountain Medical Center. My position in the hospitals is to make sure the hospital is well prepared to deliver high quality care to our community. I got to the West Texas area, specifically Odessa, Midland, Big Spring area, about 3 years ago. So it was just before the pandemic hit. So it almost seems like it was meant for me to be here at this time. So when the pandemic hit in early 2020, there was no second thoughts of springing into action, trying to do exactly what I said, make sure we are well prepared to deliver the highest quality care to the community. So that's exactly what I did. Odessa College is one of the key driving factors for the healthcare workforce in our area. We as a hospital depend heavily on places like Odessa College, who bring out the best in the workforce for serving the community at a hospital level. The second part of this is that education is everybody's job. Odessa College just happens to be a leader in that specific role. So when we were in the early parts of this pandemic, one of the things that struck me as being very important is the community collaboration. Odessa College was very instrumental in helping us arrange things like town halls, where we could educate the community about COVID-19 at different stages. In the early stages of the pandemic, when we knew very little about the disease process, to the slightly later stages where we knew what mitigation efforts worked, and then even later when we had a vaccination available to really get rid of this pandemic once and for all. Well, I'm humbled that Odessa College would see me as someone that they should honor for the work I'm doing. I always felt like these were the two parts to the job I was here to do, and I did them to the best of my abilities to really be effective to every community member. There were people that could understand things early, and there were people that required a lot more explanation, data, etc. And I was willing to come through for both of them. And so it's nice to see that educational institutions sees the value in someone in healthcare leadership, not just a physician practice, but a hospital leadership, to be able to come out there and do part of that work, which is educate the community. None of this was an individual effort. The point of all of this was that it's a team effort. So this is not a one-person effort, and I definitely have to thank the entire community for coming together to be able to make this happen.